research, we're going to have wait. You wait for until I tell you next slide, okay? Okay.
Sorry, Doc,
So
napid.
one of the reasons that you're having difficulty in coming up with specific problems, as well as later in the discussion, is on how a problem would be tackled. So there's a tool called a problem tree. So how this morning I'm going to talk about how to develop a problem tree and solution tree. But I'm just putting in solution so that you will also have an idea on how a problem should be solved. Okay. So this tool is used not just mostly in researches and usually in management, in researches both in management and in operational health researches. So at least it would give you an idea on how to tackle the problem statements that you have. Okay. So next slide, please. Next slide, please. So what is the problem tree? So a problem tree provides an overview of all the non-causes and effects to an identified problem. So it seems that you already have a lot of problems. Each group has identified four or five problems. So the question is how or to what problem to use and what problem to tackle with regards to your research. Next slide, please. Okay. So why do we need somebody, can you mute that? Why do a problem tree is needed? So there are often more than one cause to a problem, and you may not be able to overcome them all. So it's important to know if this will impact your project. So in each title or problem statement that you identified, there could be a lot of avenues or entities that that surrounds that, so that you can have a good direction. This problem tree could help you into that. Okay, so a problem tree identifies the context in which an intervention is to occur. So usually problem tree, uh, it will also guide you somehow on why there's a need for this problem to be tackled. Because if that problem has a solution, or there could be a possible intervention, then go for it. But if that problem has no intervention at all, why study it? It's just a waste of time. It's a fact of life. Kumbaga, kaya mo ito mahon nga bisan anong mo ito pag problema iya diri masusulbar. Okay, so in research it's like that. We talk in the first topic that we had, that the political feasibility, the feasibility of doing the political acceptability, the feasibility of doing the study. It has a big relevance in terms of public health impact and all. But if you just want it for the heck of it, for the sake of that, because you're just interested, and it has no intervention, then why go for it? So next slide, please. Okay. Next slide. So the process of the problem tree in making one is it's best completed with the project proponent and other stakeholders. So for you and the groups, so you are the proponent and almost all of you are part of the project. So you may need anything. So actually in actual practice, you need a couple of hours to half a day or more, depending on the complexity of your problem and the diversity of stakeholders present, for example, in actual situation. Because this one is also being used in organizational problems. The problem tree can be used in whatever sector. So in coming up with solutions, especially if you want to improve something and you want to have an idea on how to, why to look into the bottom of things, then this problem tree is very important. Next slide, please. What are the steps to undertaking a problem tree? So for example, in your group, you already have a core problem. You identified about For example, about pregnancy, or about what else, about what topics did you have about intestinal parasitism for that matter, and or about the COVID-19 something. So you identify the causes and the effects of that problem, and you develop a solution tree, or for that matter, a select the preferred interventions. Even if you have a lot of, in practicality, even if you have a lot of causes and effects in a solution tree that would be developed, still it's more practical to solve one problem at a time, or what more practical to do one intervention at a time. Okay, so one intervention at a time. So for us, for you at this level, is you will just be focusing up to one and two, which is the settling on the core problem and identifying the causes and effects, which would be the objectives of the study. Next slide, please. And knowing the solution tree, and also knowing the solutions as well as the intervention, could at least help you in coming up in the research for recommendations, and also in the discussions on this causes and or effect of the study that you had made. Okay, so what does a problem tree look like? Actually, it's just a tree, but it doesn't look like a tree. It's a diagram somehow. Okay, at the middle is your core problem. Okay, at the middle, the yellow shaded box, and below that is the immediate causes, and lower than the immediate causes are the secondary causes. So above the core problem are your immediate effects. Okay. So in reality, in also making our conceptual framework later on, if you model it on the problem tree, this is how it's going to look at. Okay, this is how it would look: the core problem at the middle, the immediate cause, and the secondary cause, and on top is the immediate effect. Okay, next slide, please. So the core problem, a project should have a specific problem, such as saving water inside the home, that is to seek to overcome if change is to occur. Okay, so a vague or broad problem could be saving water, or will have too many causes for an effective and meaningful project to be developed. So in your case, you have that big problem, for example, about vaccination coverage, and you look into what specific, and then coming up with more specifics on that particular core problem. Okay, next slide, please. So in identifying, so you have the core problem. This is the main problem that you want. And that from the core problem, you need to identify the causes and effects. So, for example, the core problem is placed, as you said in the diagram, is placed in the center of the tree. You then need to consider the direct causes to the problem, and these are placed below the core problem. So each cause statement needs to be written in negative terms. So the direct effects of the problem are placed above the core problem. Okay, so in writing your research, if you have that core problem and you have the immediate causes, then that core problem, which is your general statement, the immediate causes, or the secondary for that matter, usually at the immediate causes would be your specific problems. So in problem tree, it's made in a negative format, but in your research, it has to be made in a positive format. So you just have to transpose or change some terms into a positive way. Okay, but in the problem tree analysis, definitely since a problem, you have to make it in a negative terms. Okay, but the purpose of using the problem tree analysis is to really look into what they really wanted to study, why there's a need for this. Because if you look at that problem and you can see that you are not able to identify um, causes and effects which could be possibly be intervened in the future, then no need to look into that one. Next slide, please. In fact, I have like at least in terms of, that's why you have there in your background that the purpose of the study is to develop or to know what's happening or to determine the cause of this particular entity, so that in the future intervention can be done, and that particular issue could be solved. Okay, so if you have that core problem, identifying the causes and effects, you didn't need to consider the causes to the immediate causes. So these are the secondary causes and so on. You can do the same also to the effects. So from in your practice right now, and in part for the conceptual framework later, that's how it should be done. The middle is the core problem, and the immediate causes and the sub causes or the secondary causes will be downward. So because it's also one of the things that we you need to make in your research, is this a conceptual framework. Although there are two frameworks. One is the theoretical, and the other is conceptual. So when we talk about theoretical, it's based on the theories or based on the literatures that are being made. But in your study, you are looking into the concept, this concept, and this is the problem that you want to seek, and to identify the different causes and the effects for your particular study. So you will likely need to move causes around so as you decide whether they are primary, secondary, or other causes. So you really need to brainstorm on what things to consider as causes, so that you can really identify, or you can really see the the usefulness or the practicality of that particular core problem that you wanted to study. Okay, next slide, please. So let's look at this example. An example of a core problem is, for example, there are not enough problem trees conducted. Okay, so there are not enough problem trees conducted because, well, maybe we don't know why. So we want to know why. There are a lot of tools in identifying in identifying or looking into the causes and effects. There are like I don't know if you have heard of it, the Ishikawa diagram or the fishbone analysis, also the cause and effect relationships. So I want to lecture on the problem tree analysis because at least it would be useful for you in coming up with conceptual framework, because the cause and effect as well as the fishbone analysis is more practical in operational health management researches or studies. And for clinical researches, at least problem tree analysis is more or less practical in terms of identifying the causes and effects, so that that would be your specificities that you would entail to be covered for your general problem. Okay. So for example, in this one, there are not enough problem trees conducted. So why? There's always that why. Next slide, please. So let's look at the causes. One is people do not know what a problem tree is. Okay. Another is people do not know how to do a problem tree. So these are your immediate causes. Definitely, if they don't know and they don't know about that and they don't know how to do it, then definitely there are not enough problem trees that are going to be conducted. Next slide, please. So these are the immediate causes, and down below are your secondary causes. So people do not know how to do a problem tree, so there are easily no accessible resources. For example, they don't know where they can have that knowledge. They could have the technicalities, and resources are hard to understand. Okay, so from that immediate cause, you will come up with the causes of that immediate cause. Okay? So which means imo paginhimay and imo kausa. Which means kung imo problema amo ini, imo ginhimay why this problem occurred. Ano ang iya cause? And that cause, again, you need to identify what could be the other causes. So that would be the secondary causes. So this one, that's why in the problem statements, in the problem the identified problem that you have, you can also do this one so that you would understand how or the complexities of that particular entity would look like. Okay, next slide, please. Next slide, please. So this is an example of wait, go back. Okay. So this is an example of a completed tree problem. It's so complicated somehow because it's supposed to be like that so that you can really see what are the different causes of your problem that was identified. For example, again, this is very important in the placement. So on top, above the with the light brown shade, or what color is that in your laptop or computers, are the effects of that particular problem, and this below are the causes. So for example, in this problem tree, they would like to have a recyclable products placed in the waste bin. So that problem is the core problem is they just want to have that products placed, the recyclable one in it. So how come? Why? What are the immediate causes that the recyclable products are not placed in the waste bin? Okay, one is there is no room in the recycling bin because siguro it's full already, puno na. Another is there is no recycling bin. They want that to be placed in the recycling bin, but there is no recycling bin available. Another is people are not aware that products can be recycled, or people are too lazy to recycle. It's another cause. Another is not all people in the household or in the house recycle. And another cause that they saw is that there is no process to sort recycled products. So what's the use? You want the recyclable products to be put in a bin, in a waste bin, pero they're not doing it because they can see, oh well, even if you put it in that particular bin, if there's no processing, what for? In fact, that's also similar to what is happening to the garbage truck collection, that they would like the segregation to be in place. But if you are going to, in reality, if households are going to segregate their waste, solid waste, but if the truck passes by and pick the garbage, everything are again mixed up. So people would see that and would recognize that as unnecessary, so that at home now, people are not practicing how to segregate. So, for example, in Tacloban City, that issue or that cause was seen on why people don't segregate their waste products. And that's also one of the reasons why they have a public and private partnership in terms of their implementation on solid waste management. So there are trucks that are going to collect this product, this solid type of solid waste. So they are color coded. I don't know if it's being done, but that's supposed to be like that. That's the purpose of the PPA for PPP4. So so there's a rotation that if this time or hour the truck would pass by, these are the colored bags that should be placed in the truck. And in this particular day, again, in the time of in the hour, this particular colored bag, the segregated something, would be picked up. So in that identifying solutions for these problems. Problem three is very important. Okay, so from the immediate causes, they identified secondary causes. One, I think this one is very good. There is no people are too lazy. People are too lazy to recycle, as well as people are not aware that products can be recycled, and not all people in the house recycle. So what are the secondary problems? If you can see, there's a the secondary problems could also be the cause, or also causes the immediate cause. Okay, so one, the council is not provided into on recycling, so there's no policy for the recycling in the local area, and the product recycling information is confusing. So people are not aware because they cannot understand what what should be done about recycling. And people do not think recycling is worthwhile because people are too lazy to recycle. So maybe they don't understand the importance of recycling. And from that, you can go down deeper if you can still look some secondary causes on that second on tertiary causes or other causes to that secondary causes or immediate causes. So again, council has no are not provided into recycling, which means the local the sangguniang barangay or the barangay did not consider that one because there is no funding for it. They don't find it necessary. They don't have funds for the recycling bins. And there are no standards on the recycling, as well as people are not aware, do not think recycling is worthwhile because they are not aware again of about the recycling. And some do not have that, some do not really consider that. That's why in the planning on recycling, because of that awareness and because of this, a lot of interventions and a lot of solutions were formulated. So for your research, making this thing is going to be very useful so that you will have your core problem will be your general statement, and your specific problems or specific objectives or general objectives will be your specific this immediate causes could also be your specific objectives. So this one is in the problem format. So in your research, it's going to be in a positive format. Okay. So, but not in that context, but in the context of the research that we are doing. Okay. So I will just continue so that you will be able to, I will just continue because this one is the problem tree, and we will now go to the solution tree. Because as I've said, while as I've been telling you that if there's no solution for that particular problem, and if the problem that you were able to identify is just a fact of life and it's has no sense in pursuing, then don't go through with it. So the main purpose of why I would lecture you on the solution is that you can also understand that even this is a research one uh, part of the completion of your medical school, but still, as I've said, this is going to be a lot. It is going to have it has a lot of importance in your profession, because one of the issues right now that we're having in the hospital, because all hospitals are engaged or encouraged, they're not going to be given a performance grading. There's a grading performance standards that they need to qualify or to satisfy. Otherwise, their hospital will not be given a license to operate. Whether it's a private or a government hospital, especially if it's a training hospital or tertiary hospital, the need to have researches being conducted by the doctors as well as the consultants, the resident physicians, consultants, the manpower, the nurses, as well as the administrations has to they have to do it. Like well, I've been reiterating that not only in the health parlance, especially across in the medical field, but also in other agencies. But for us in the medical field, it's really important to conduct researches. And now, because of that policy in doing researches, there are even an increasing demand, also an increase in the requirement that hospitals should conduct this and this kind of researches. So these researches that we are conducting are just the simple ones, but it should be it should be an encouragement for you or a motivation for you that later on a more higher designs would be at your par, which means if you're just doing a lot of descriptives now or a simple type of kind of researches, but I suppose when you go higher in the rank, you go higher in your career, different kind of methodology would be applied. Okay, so it's a challenge. So I'm thinking that even at present, the resident physicians are just at your level, if I may say so, because the things that they are doing, it's just like, except for the fact that they're doing the actual data, they're now looking into the patient's profile and patient's documents. But what I mean to say, if we'll compare the skill that are going to be imparted between you and them, the difference that you're in group but they are in a singularity. So in effect, if I was even thinking that if they had been if the research was being part and parcel of the medical school way back in their time and in our time, then our research capabilities would have been higher. So I know this is a subject for you, it's kind of complicated, but you have to make use of the opportunity and the time to learn something. Because as I've said, all the topics, all the subjects that we have, it will all boils down into making a research. Okay, so next slide, please. Next slide, please. Next slide. Okay, so in you have that particular problem already. You have that particular problem tree. You were able to identify the causes, and that causes has to be consensus, which means that cause there are going to be a lot of causes, but if it's not again going to be solved, then don't think about that one. It has to be practical also. It has to be have that solution in mind. So in developing again a counterpart of that solution, I would just like to lecture this one because so that you can really identify or at least come up with an idea that if that problem is not solvable, scrap it. Okay, so on the other hand, the counterpart of that problem tree is a solution tree. So a solution are also called objectives now. Objectives called objectives tree. A solution tree is developed by reversing the negative statements from that form of the problem tree into positive one. So it was in a negative format and this one in a positive format. So again, this is going to be useful in your research. So for example, a cause or a problem tree such as lack of knowledge would become means as an increase in knowledge. So the objective tree demonstrates the means and relationship between objectives. Next slide, please. Okay, next slide, please. Okay, so wait, go back. Go back after.
Amo na po, Dok. Select the
Okay,
preferred intervention.
balik daw. Another one. There was a problem. That one is a solution tree. Ano ko? Sige, next. What do you hear? 3? Okay. Ano day? This one is an example of a completed solution tree. So as we said, these are in the positive format, which is compared to your one by one. Ano sa one by one? This one is the example of a completed tree solution. So look, okay, this one is in a positive format. So the core problem now is in a positive way. The recyclable products is no longer placed in waste bins and are recycled. Okay, so the solutions: recycling bin has enough room. Households have a recycling bin available, and there is no immediate causes because there are no more households have a recycling bin where households have no recycling bin, so now they have. So there's already an immediate solution to that cause, so no need to go farther for the other causes of that particular cause. So another, people are aware of what products can be recycled because council provides into and recycling is now a policy, and they were able to give funding solution for that problem. Huh?
Excuse me,
And
Doc.
also, uh,
Excuse me, Doc.
time na?
Opo.
Okay, you just study this one at your end, but again, you look at this lecture in order to identify your specific objectives. Okay, so for those who are having problems with your general statement or your problem identify problem, you please look into this one so that down below the immediate causes would be your specific objectives that would answer your core problem. Okay. Okay, because unless you know this, you won't be able to have, we'll just be circling around your general problem. If you understand this concept, then you would have easier context in making your paper. Okay, have you had your picture already of the attendance, please? Anyway, the last slide are the interventions. Okay.
Tapos na po, Doc.
Okay.